Okay, please let everyone in.
Don't worry, I don't have to ask him yet.
Morning. I hope you can hear me. I couldn't hear that video when it was playing, so I hope you can hear me. My name's Ngozi Ediosage, and welcome to another Saturday Health Hour. I can't believe that we've got to the end of January already. It seems as if it's gone really quickly. So a really quick start to 2023, and I hope you've been joining us for each of our health hours each Saturday. So we've got the amazing Dr. Joe, who is a GP and also a pastor, duly blessed, I say, who's going to talk to us today about panic attacks and general anxiety. So I don't know about you, but there are lots of things that make me anxious. Just before we went on air today, Dr. Joe said he was going to vote me for president. That made me very anxious. So I'm looking forward to this talk this morning. But to be serious, I know it can be a problem. Panic attacks and anxiety can be very debilitating. So please join in. This is our offer, the Caribbean African Health Network's Health Hours offer to you. It's your health hour. So if there are questions you have, put them in the chat, raise your hands. This is interactive and it's for you. So nice to see you all, and over to Dr. Joe.
Good morning. Thank you, Ngozi, for the warm introduction. Good morning, everyone, and good morning, family. It's good to be with you all again. My name is Joseph Osage, Joseph Omofuma. I am a GP in Rochdale, here in Manchester, with special interest in mental health and reproductive medicine. So I also sit or double as the mental health lead for the Caribbean and African Health Network. Let me just say, because people have asked me in the past in other forums, we don't get paid, or we don't request to be paid to do this. We see this as a service to the community. It's our pleasure and an honor for us to do that. I'm not being sponsored by a drug company or being paid by any other company for that matter. One of the things that we'll be talking about today is a subject that I think is really, really important because it is poorly understood, especially in the Caribbean and African communities. So today, we'll be talking about anxiety and panic attacks. Let me just start by saying it's a rather verbose, large topic. And so what I'm going to try to do today is to define a few terms, link it up with a few symptoms, and talk about treatment. And then wherever we stop, if we have questions and queries afterwards, we can continue some other time. The reason why I say that is because we try to pace, well, at least I try to pace these presentations in a very simple way that everyone can understand, knowing that not a lot of health professionals may be on the call. So what I'm trying to say is if I was presenting this to my colleagues, I would be presenting it definitely in a different light. But also one of the things what we try to do is to kind of help you to either identify yourself or identify your loved ones or your community or your members of your family in this talk so that we can help improve our overall health. Mental health in general is one of those things that many of you are aware is quite stigmatized in the Afro-Caribbean community. I don't know about you, but I grew up in a typical sort of Nigerian home, and there was no such thing as, you know, mental health. You just got on with things, and that was the expectation. But thankfully, we are older and wiser, and we can hopefully try and make a difference with people. Like Ngozi alluded to, anxiety can be very debilitating to the point where people are paralyzed physically from anxiety. So it's a really, really important subject that we need to talk about. Can I please ask everyone to please mute their microphones if you are not speaking or asking a question? It just helps the transmission so with there are fewer interruptions. All right, I'm going to try and share my slides so that we can get everybody along, if that's okay. So please try and follow with us as we go along. I'll try and be as slow as possible. There's a lot to be said, like I said earlier on this subject. And today I feel we're only going to skim the surface, if you like, because this is something that, well, maybe because this is what I do, but there's a lot into it, there's a lot that goes into this subject. And, you know, sometimes it's difficult to just bring it down to 20 minutes. So generalized anxiety disorders, it's basically a range of disorders that include panic attacks. So it's a broad name for generalized anxiety. It's a broad name for panic disorders with or without agoraphobia, and we'll define that there for you. Post-traumatic stress disorder, obsessive compulsive disorder, social phobias, specific phobias such as arachnophobia, fear of spiders, and also acute stress disorder. So generalized anxiety disorder is an umbrella term that is used to cover all of these, inclusive and not, there's more, but this is just includes this as well. Now, we're going to be defining things going forward, but I thought I'd just chip this in. I don't like giving presentations where people don't understand what you're saying. So the idea is to put the cookie on the lower shelf and hopefully help everyone to be able to follow along and try and understand. Agoraphobia is an extreme or irrational fear of entering open or crowded places, even to the point of leaving one's home or being in a place where escape is deemed to be difficult. Generalized anxiety disorders are quite common, and the central feature of it is excessive worry. And it has specific criteria for accurate diagnosis. Why am I saying that? Everyone gets anxious, like Ngozi said at the very beginning, everyone gets anxious, but it doesn't mean that everyone has a generalized anxiety disorder. If you recall, for those of you who have been in previous health talks, one of the things that I've highlighted quite candidly is the fact that many mental health symptoms or many disorders are actually extensions of normal feelings that we all have. So everyone gets anxious, you know, When my team is playing, I get anxious. That nowadays, I think they're doing better, even though they lost to Arsenal the other day, very sadly. But when my team is playing, I get anxious. But that doesn't mean that I have an anxiety disorder. And so we're going to be talking about how do you define that, because I think it's really important for us to define these things properly, identify it, and then begin to look for ways of how to deal with it. Because part of the problem we have in the Afro-Caribbean community is there's a lot of misinformation, there's a lot of assumptions, and then also for those of us who are religious, we spiritualize everything. You know, we over-spiritualize things. There's nothing wrong with spiritualizing things, but when you over-spiritualize things, then it becomes a bit of an issue. Because not everything necessarily has a spiritual root in that sense. So anxiety disorders can exist in isolation, but more commonly they exist with other anxiety and depressive disorders. For example, schizophrenia, they exist in Alzheimer's, they exist in other paranoid disorders and things like that. Let's define a few terms, because we said that generalized anxiety disorder includes panic disorder, which I will speak about separately, so I'm not going to define it now. I want to give more time to that. Includes panic disorder, it includes post-traumatic stress disorder, it includes obsessive compulsive disorder, social disorders, specific phobias, etc. So what exactly are these things? Because in my experience, when people begin to speak about these things, they think they know what they're talking about. They actually do. Unfortunately, by the time you interact to a degree with them, and even some health professionals are guilty of this, they don't really understand what it is. There are specific definitions for these things. And so it's really important that we understand what it is, and to be clear what exactly it is. So PTSD for short is a condition of persistent mental and emotional stress occurring as a result of injury or severe psychological shock. Please note the terminology: injury, severe psychological shock, typically involving disturbance of sleep and constant vivid recall of the experience, with dulled responses to others and the outside world. So I think it's really important that PTSD can be very, very serious. And I don't mean to sound like a broken record, but I'm going to be emphasizing this throughout this talk, that anxiety disorders in general can be quite severe. And like most mental health things, they occur on a spectrum. There are some that suffer very mildly with it, and there are some other people that suffer with very severe symptoms. PTSD is quite common in people who have served in the military, people who have been in an abusive marriage or relationship, people who have been emotionally abused by parents or teachers, people who have suffered from racism or prolonged oppression. PTSD is, so there's a lot of things that PTSD can do. And we'll probably, if there's time, expatiate on that. If you have questions, please, or comments, please put it in the comment group. It will help us, because we want to make this interactive. I don't want to sound like a boring psychiatrist, which I'm not, because I'm a GP. But I will try and make this as interactive as possible. For example, when we talk about phobias, can I challenge everyone who's on to write your own phobia? What do you think your phobia, or what sort of phobia have you experienced? Or what sort of phobias are you familiar with? I'd like to see what comments people come up with, and I'll explain why in a minute. Because I think, like I said before, people get these terminologies wrong. People talk about stress. Oh, I'm stressed, or I'm anxious. You miss the bus and then you're stressed. Okay, so from my perspective, if I'm going to be speaking stricter senses, if I'm going to be speaking very strictly from a medical perspective, that is not stress. You're worried, that's fine, but that's not a disorder per se. I get you. I'm guessing you guessed my drift. So obsessive compulsive disorder, moving on, is a disorder in which a person feels compelled to perform certain stereotyped actions repeatedly to alleviate persistent fears or intrusive thoughts. Now, this is where it's important. Some people spend less than an hour engaged in obsessive compulsive behavior. For others, it may consume their whole day, which is why I was saying in terms of spectrum of illness. Some people have very mild illness within all this, and some people have really severe symptoms. Social disorders are such that people have an overwhelming fear of social situations, meeting people, speaking to people, often long-term, and should not be equated to shyness, all right? So let's look at specific phobias for those who, if you're participating in, this is just, there's about 100, but I've picked about the first big 5, if you like. Arachnophobia, fear of spiders. I have a couple of little girls in my house that do not like spiders. That is not arachnophobia, but they do fear spiders. I remember growing up, I didn't particularly like cockroaches, and I'll tell you why. I learned in my class that cockroaches carry germs, which is true. They carry a lot of germs. And so the thought of seeing a cockroach around me repulsed me. So I thought for a while that I had a phobia for roaches, but I don't, because if you give me a pair of gloves, I'll grab them off the wall and throw them in the bin. People who have genuine phobia will not even come into the house where they think there might be a cockroach. If they think there might be a spider, if there is an image of a spider, it can set things going. So that's how bad these phobia disorders are. It's not just your average run-of-the-mill, I'm afraid of this or that. It's quite severe and quite debilitating. So you've got claustrophobia, fear of tight spaces, acrophobia, fear of heights, agoraphobia, like I said before, fear of open or crowded places. Some of these things can develop over time as well, depending on your experience. And we'll be talking about predisposing factors, because if somebody will ask me, can people be born with this? Is it inherited? And we'll come to that. Yes, some of it have genetic predispositions. There's no specific link, but most of it is what we learn as we go along. Acute stress disorders are really important. They are reactions that occur within 1 month of a major life event or trauma. Okay. Now, if an event is less than a month, we call it an acute stress disorder. If it is greater than 6 months, that's when it becomes PTSD. This separation is very important because it has implications for treatment. For example, with most acute stress disorders, we can give things like benzodiazepines, diazepam, and things like that, because we know that it's an acute stress reaction and the patient or the person is going to come out of it. We don't necessarily offer those kind of treatments, just for the sake of an example, to people who have PTSD, because we know that this is an ongoing chronic problem and it may not necessarily help them. Also, looking at a couple of papers, for those of you who may be inclined, acute stress disorder does not necessarily equate to identifying, does not necessarily lead to PTSD, as explained by Bryant and Co. in their research in 2010. With generalized anxiety disorders, formal diagnosis is required, all right? So this is why I was saying that you can't just see someone and say, mate, you've got this. There has to be a formal diagnosis, and there's a way to actually diagnose that. So it requires 2 major symptoms occurring more days than not, so at least 3 or 4 days in a week, for at least 6 months. So you can't really say someone has a generalized anxiety disorder if the symptoms have not been there for 6 months. This is why it's really important. This is not somebody who is shy. This is not somebody who is anxious. A lady said to me, I've got worry gene. There has to be a specific diagnosis to it. I'll give you a couple of case studies around this before I move on. I hope I remember to do that. So it's often characterized by excessive worry, excessive anxiety and worry about a number of events. Now, here is the clincher. Most people find it difficult to control the worry, and most of the time, there's no obvious reason for them to be worried. This is really important. There's often no specific reason why that person should be worried. Many times, there might be an underlying thing that's happened, and that person has either buried it or kept it hidden deep within them. But very often, it's excessive worry about things that you and I may not necessarily worry about, but they struggle to control it, and they often struggle to identify what the cause is. So there's that excessive worry in addition to 3 or more of the following. So they may feel restless or keyed up or on the edge all the time, easily tired, easily fatigued, poor concentration, or the mind going blank, having a fog mind, irritability, muscle tension, sleep disturbance is a big one, very, very big one. And like I said at the beginning, for those of you who are joining late, part of it is to help you either identify yourself or identify your loved ones or family members or people in your community that may or may not be exhibiting some of these symptoms. So I said I was going to give you a quick study. There was a lady that I was dealing with who, very interesting actually, because that's why I wanted to share. And she had been a very successful professional all her life. She had coped really well in a top job. She rose to become a manager in her job. She controlled a large number of staff. She retired at the age of, I think, 55. She decided to retire at 56, something like that. Immediately she retired, she struggled because all along she had controlled her anxiety by ordering her life in a very specific way. Now, nothing was allowed. Her husband came to me and said, nothing was allowed to alter that program. So she had herself into a rhythm. She knew exactly what she wanted. And, you know, I hope you don't mind me saying this lightly. Sometimes some of those people are really difficult to work with, because if you move their coffee mug, you know, if you change the direction of their pen, it's war. Now, she had succeeded. When she suddenly retired, she couldn't cope. She couldn't go out of her house. She couldn't go to the shops. She didn't know what to do with herself. And we then had to start giving her lots and lots of medication, get the psychiatrist involved, etc. But she had coped all along very well with her life. You know, unfortunately, along the line, she developed high blood pressure. And I think I talked about this in previous, these things are predisposing factors. If you allow anxiety, this is another thing, if you allow anxiety disorders or panic disorders to persist without treatment or without attention, what happens is you begin to develop somatic or physical symptoms. And these physical symptoms can then inadvertently lead to illness, such as high blood pressure, heart attacks, etc. So moving on quickly to panic disorders. This is a form of anxiety disorder where one has regular sudden attacks of panic or fear. It's often characterized by the following symptoms, like I alluded to: pounding or racing of the heart, sweating, chills, trembling, difficulty breathing, weakness or dizziness, tingling or numbness of the hands. Sometimes some of these patients come to us when I used to work at A&E saying I'm having a heart attack. Actually, they're not. By the time for more experienced clinicians, and as you observe them long enough, you'll find out that they don't have all the typical heart attack things. And by the time we do all the proper tests, empirical tests, you find out that they're not having a heart attack. It's an anxiety or a panic attack. So, but they have all the symptoms. They can feel their fingers going numb. They have chest pain, dizziness. I'm saying this because, especially in our community, we tend to downplay a lot of these symptoms, get a grip of things. We don't really put a lot of premium on it, and why this person behaving. These people are experiencing very, very serious, very, very real symptoms. No, so the flip side of this, however, is what I've also experienced, that people who have like borderline personality disorders, they know that these are the symptoms and they play around with this. And I don't have time to go into that today, but some of you would have experienced that, where people pretend that they have certain symptoms in order to either gain affection, favor, or even cheat the government out of money, etc. Those are not genuine disorders. And by the time you take them through psychometric testing, you'll be able to distinguish between, with proper observation, most of the time you're able to distinguish. And that is like borderline personality disorder. That's not really a proper disorder. Well, it's a disorder on its own, but it's not a panic disorder. And, we'll talk about that if time permits. So predisposing factors, I want to quickly speak so I can have room for questions. I'd like to tackle some questions. Some of the predisposing factors, we've already alluded to them: trauma in any physical shape or form, physical trauma, emotional trauma, psychological trauma. When I was younger, I had a friend whose parents used to physically beat them with a cane and a belt. And what it did for those guys, those boys, it made them hard. And unfortunately, some of them didn't quite turn out right. One of them actually ended up in prison. I'm not saying that if you beat your child, they're going to end up in prison. Please, I'm not saying that. I'm just saying that trauma has a deeper consequence than just the physical scarring. So there's physical trauma, there's emotional trauma, there's also psychological trauma, forms of abuse that may not be overt, like emotional abuse or neglect. Neglect and emotional abuse are some of the most common causes of abuse, especially in pediatric. And some of the pediatricians will help me out. I think it's emotional abuse and neglect that are high up. Whereas what we often see, or what disgusts us, or what makes the headlines, is physical abuse. Where you shake a child, or you people who have used cigarette burns on children. Horrible as it may sound, it's not as common as emotional abuse, and sometimes not as severe as emotional abuse or neglect. Moving on, like I said, each of these topics, I'm kind of like hesitant, because each of these are topics that we can speak about on their own, like in their own merit. And, we could spend tons and tons of time talking about it. But I just want to give us a brief overview so that we can start a conversation, have an idea, identify a few things, and perhaps going forward, especially for the team, if you have any issues, or if you have anyone who needs this, we do have a counseling unit within CAHN. It's absolutely free of charge. I would encourage you to get in touch and take advantage of this service that is being provided by CAHN. If the administrators would please put the details in the chat, that would be helpful, because you never know. See, we get into this job as medics to try and help people, and part of why we do what we do here on a Saturday is to try and help people. We're not just here to chat to a camera or talk to. We want to see how we can move people from point A to B and sort of get people. A lot of people are suffering in silence. I'll tell you that as a pastor. I see a lot of people going through a lot of difficulties, and very often, this is the point I was trying to make that I forgot. Very often, people who are going through some of these problems don't even know that they have a problem. And that's why I said at the beginning that one of the important things is being able to identify and recognize that there's an issue here. A lot of times, people who either have generalized anxiety disorder, they don't even know. They've not sort of come to the awareness or cognizance. They just know that there's an issue, or people around them may know there's an issue. But very often, I don't have percentages and figures for you, but empirically, many times, most of my patients, they tell me there's nothing wrong with them. They tell me, oh, I'm not anxious. By the time I take them through psychometric testing, we ask them specific questions, and then they score off the charts on these things. And then either their partner, the husband, the children will then begin to say, actually, we've noticed this about mom. Mom has this and that. And so I said all that to say this, that part of it is to help us really, really begin to recognize and identify and see how we can help people move away from some of these things and hopefully give them a better quality of life. And at the end of the day, that's what it is all about. So predisposing factors, like I said, military experience can be terrible. People see a lot of violence, in military. I served it was a paramilitary group. I was a health professional. I wasn't in the military, but I served. And when you hear soldiers talking, they've been through stuff. They've been through stuff. They've been through even armed forces, police, the amount of violence, and even medical people. When I worked in the emergency department, for example, and I don't want to put you off your lunch or your breakfast, there was a young Polish guy that was brought into the emergency. He was working at the airport, and part of his arm had been torn off by a plane because he stood too close to something, and part of his arm was hanging off. Some of my colleagues became physically sick. Some people had to go off sick. I was one of the people attending, and I still remember it. It's almost 20 years ago. I still remember it. This is sometimes emotional trauma. There have been times when I've been treating people, and I don't know why I'm saying this, maybe to help somebody. There have been times when I've been treating people, and the amount of stuff that people go through. If I was the crying type, which I'm not, I'm not saying that to sound tough, but I'm not, unfortunately. If I was the crying type, sometimes I just feel like going somewhere to cry because people are going through a lot of stuff. But that's part of it. And so even for health professionals, we have to learn to look after ourselves. And many of you who are teachers, social workers, things like that, some of the stuff that you see is actually emotional trauma. And being able to recognize that and then to go and look after yourself is really, really, really important. Really, really important, because all of these things affect all of us in different ways. You know, some of us are able to handle some things more than others. All right. So things like gun and knife crime, you know, violence. I used to live in a part of Manchester, I wouldn't mention it, but I used to live in a part of Manchester. I got robbed twice. Not at gunpoint or anything. They broke into my house. It just violated me. And I felt, I moved away from there quick. I moved into the hospital premises. But I just felt unsafe. So things like that, so very subtly, they affect us. They affect us. They cause us to begin to think more. And this is why I'm saying that some of these things can grow on you and develop with time. Racism, microaggressions, marginalizations, oppressions. Relationship breakdown is a big one. All sorts of relationship breakdown. Marriage, romantic relationship breakdowns. Father-son relationship. Daughter, father, daughter, mother. I could speak for 2 hours on this, but I will not do that today because I don't want to bore you into stiffness. But this is something that when you don't pay attention to this, it not only affects you psychologically, it actually affects you physically. I've seen people getting ill from relationship breakdown. You know, one lady who was in her 30s, she was so upset with her mother that every time you brought up the issue of her mother, she physically began to shake. It's not healthy. And, I'm not belittling anyone's illness or situation or anything like that, but this is why we're doing these health talks. We need to find a way to break away or break free from some of these things because it's not helping. It doesn't help you physically, it doesn't help you emotionally. I often say this in my religious talks, hurting people hurt people. I'll say that again, hurting people hurt people. Many times when you're hurting, inadvertently, you don't mean it, but when you're hurting, it becomes inevitable that you'll hurt somebody. You'll take it out on someone. It might be your children. It might be your co-workers. The lady who was always cranky. Honestly, when I first came to the country, I used to wonder what's going on with her until we found out that she had a really bad relationship at home, but she took it out on all of us at work. We all bore the brunt of it. This is not something that we should be practicing. All right, I move on. Relationship breakdown is really, really important. Really, I think this is perhaps, again, one of the most common things that we see, and it can be very subtle. We all need relationships. We are social creatures. We need to be in that. It gives us a sense of safety. It gives us a sense of community. And that is one of the biggest therapeutic things you can do. Being a community or have an association with people. This is by research. Isolation almost is as bad as having a heart attack for some people in terms of the effects that it has on you. So really, I can't overemphasize that. Anyway, let's move on. Predisposing factors, financial downturn, yep. Job losses, when you're fired, terminations, etc. Even retirement, can be traumatic if it's not well planned. And, we need to put our eye on the ball on that and make sure. The number of retired people that have had to counsel or send for further counseling is on the rise. And over the years, I've seen that happen over and over again. Now, this is a big one, genetics or family history. There is no exact link between, in terms of genetics, but there's a lot of research going on, and we have found that most people who have an anxious parent or somebody in the family, it increases the likelihood that you will be anxious. A good example, the case study of a woman who, she brought the daughter, this is interesting, and I know I'm running out of time. She brought the daughter in and said, my daughter is always anxious, blah, 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 fix her. That, not exactly in the same words, but that was her attitude. By the time we got into it, we found out that she was 5 times more anxious than the daughter. And part of her anxiety was what was spilling over on the 14-year-old girl that she had brought to me. So there is that aspect of connectivity between families. I move on swiftly. Like I always like to say when I give mental health talks, there are physical conditions that can mimic or behave like a mental health disorder. And the onus is on us or your GP or your health professional to extricate these things first. In other words, remove the plausibility that it could be this other thing before you then assume that it's a mental health disorder. So an underactive or overactive thyroid can behave in the same way as an anxiety disorder, especially an overactive thyroid. A parathyroid disease, parathyroid glands are beside the thyroid, they can do the same thing. Pheochromocytoma is a renal or kidney problem that causes a release. You know, when you have adrenaline and you're hyped up, in pheochromocytoma, there's an excessive release of those adrenaline type hormones, and people are always on the edge. Now, if you're not savvy or if you're not careful, you may think you have an anxiety disorder, whereas you may actually have a kidney problem that's secreting too much. So the message in this is that always get yourself or your loved one checked out first. Make sure, insist on it, that these things are looked into before a label is put. I've given this example before, and I'll give it again. There was a young lady, Nigerian girl, who was brought to me. The attention was brought to me about the parents. Long story short, she was hallucinating, having delusions and things like that. This brilliant, bright girl. I interacted with the parents. She was on course to go into study medicine. All of a sudden, things began to happen. She was having hallucinations, seeing things. And, she was being labeled as being schizophrenic. It just didn't sit right with me. So I went with them to the hospital. I did, yes. I went with them to the hospital, spoke to the psychiatrist and said, why don't you test this girl? Why don't you get her tested, for other things? Long story short, she had a rheumatologic disorder. She had lupus, and she had been diagnosed 2 years prior, and she hadn't been taking her medication. So things had built up, and she was having, immediately the rheumatologist got involved and she started taking the rheumatologic medication. She became better. She's currently studying at a university here in England. So we have to be careful that we don't label everything as, mental health or this and that without checking. Angina, mitral valve problems, heart problems, atrial fibrillation or atrial tachycardia can behave like that. Dementia, schizophrenia, like I said at the beginning. Now, obviously, the use of drugs, especially amphetamines, can give you symptoms of panic or anxiety disorder. I've seen this live, time will not permit. Cocaine, cannabis, especially cannabis. This is for those of you who have young ones, or for those of you who are young at heart and decide to use cannabis. There's a lot of stuff going around. I've seen a couple of cases where the cannabis was mixed with something else and caused a psychotic disorder. I shall not go into too much detail. So getting back on track, how do we deal with all of this? How do we begin to, try to cope with this? So like I said at the very beginning, I think identification and recognition for me is really important. I think it's key to be able to sort of discover what this is, try and recognize it for what it is, and put a finger on it. That may well involve speaking to a health professional. That may involve getting some counseling. That may involve getting some support. But also, once the diagnosis is there, taking ownership, if you like, or accepting of that. You see, this is not a negative thing to say, look, I have an anxiety disorder. For example, you may have sickle cell disease. There's nothing wrong with saying that. Africans are very good at rejecting things. I reject this and I reject that and all of that. Faith calls those things which are not as though they are, not the things which are as though they are not. I'll say it again. Faith calls those things which be not as though they are, not the things which are as though they are not. So if you have an anxiety disorder, please, por favor, excuse me, get the help that you need by, first of all, just accepting that this is the issue, because that goes a long way in helping you and helping the health professional to be able to deal adequately with that problem. I see it a lot. I don't know about I don't know about other people, but Afro-Caribbeans, my goodness, you guys, they will reject everything. Say, it's not me, it's not from my ancestors, this and that. But you're suffering with it, and it's affecting you. It's affecting your love life. You can't keep a good relationship. The man is tired of you being OCD all the time. It's affecting you at work. You keep changing workplaces. It's affecting your sleep. It's not causing you to have high blood pressure. I don't think God wants that for you, whatever God you believe in. That's a different conversation. All right. So anyway, getting back on track is, let's identify it. Let's see what it is, and let's begin to look at ways of healing. So please, first of all, like I always like to say, seek professional advice. I know access is difficult these days. There's 2-3 weeks to see your GP. Somebody put a comment on Facebook and said, put a comment, it's going to take 2 years to see his GP. I thought that was a bit extreme. I don't think that's the case. I think it's more difficult to see a neonatologist, but that's a different argument completely. But so seek professional advice, get help where you need to. Let's make some lifestyle changes. You must have heard this from Mo last week, or is it the week before, in terms of changing your lifestyle. Sleep, good work-life balance. We've said this before, diet, exercise, all those things help in getting back on track. Now, treatment modalities basically loosely are border on either medication or psychotherapy. That's basically what we use in the NHS. I think the newer treatments are coming in, like mindfulness, but they're all part of psychotherapy, if you like. But so pharmacologically, there's all sorts of medication, SSRIs, SNRIs. The medics will help you with that. I don't think this forum is necessary for that. If you are on a tablet and you'd like some more information, by all means, get in touch with us. health@CAHN, I can't remember the email. Please email, guys, you can put it on for us. But there's medication treatment and psychological treatment. Now, there's nothing wrong with taking medication for this. I had a lady who was on medication for close to 15, 20 years. What was interesting about her was that she led a very fulfilled life, became a top manager in her job, again, retired at the age of 56, 57, something like that. She had very good children. One of them became a doctor, but she suffered with anxiety and was on medication for a long time. The point I'm making is this: don't deprive yourself of good quality care because of some sort of stigma that, oh, I'm on medication or things like that. All of us have some areas in our life where we are deficient or we are struggling with, and so I don't think there should be any shame in that. As one of the big things within the Afro-Caribbean community, the whole stigma of mental health still remains, but we're all broken in one way or the other. So don't let anybody fool you that their life is totally perfect. I still have my struggles, and I won't share them with you, but I struggle when there's carrot cake on the table to control myself. But anyways, cognitive behavior therapy is a good one. It's very important. Counseling, group therapy, resilience building, very important. Mentoring, community is very important. Don't isolate yourself. Mindfulness, etc. So I think that's my talk very briefly today. I'm sorry I've shot beyond what I normally would, but like I said at the very beginning, it's a huge, huge topic. And I wanted to try and do justice to it by simply today just defining some terms for us to go and chew on, look at it. And my slides are available for anyone who needs it. Please email the guys, the team, and they will give them to you. Thank you.
Thank you, Dr. Joe, for that quick whistle-top tour through what is a really interesting and concerning topic. We've had lots of questions in the chat, and if anyone wants to ask questions themselves and put their hands up, you please feel free. As I said at the beginning, for those of you that were here, these sessions are for you. So please make use of them if you have questions. Thank you. I found that fascinating. One of the things that somebody's put, I mean, everybody can see the questions, but I've had somebody's put a private question as to what is the difference, they've said, between anxiety, an anxiety attack and a panic attack. Does it matter about defining the difference?
In very strict sense, that's a really good question. In the strict sense, not really. They are kind of they overlap. So whereas anxiety symptoms may be more of, and people, even professionals, use them interchangeably. Anxiety symptoms, in terms of where the difference may come in, is the physical symptoms. So with anxiety, there may be hyperventilating. There may be more of that. There may be more of phobias of wanting to go out or wanting to speak to people. Whereas with panic attacks, you get a lot of very physical symptoms, chest pain, tingling of the arms, and things like that. But by and large, you can always have a crossover between the two of them.
Okay, I hope that was helpful for the lady that sent me that question. And there's lots of comments as well, agreeing with a lot of the things that you've said today. So someone's made a comment about things that trigger individuals to have future anxiety and panic because of things that might have happened in their childhood, as you talked about as you mentioned in your talk. I know you're our mental health lead. How often do you see people that, in actual fact, you can identify things that have happened many, many, many years ago? So adults that have found things that have happened in their early lives. And what do you do about that? Because it's happened now. It's still having effects many years later. And if you want to avoid medication, I know sometimes medication is indicated. What do you do? How can you help?
Thank you, Ngozi. That's a really good question. The thing, first of all, I think it's in two parts, where in many cases, it's actually incredibly difficult to pinpoint the trauma. A lot of people often don't know that there has been a trauma until you've asked them a few questions. So sometimes it's in the third session. And also people struggle to open up to you. So it's often in the third or fourth session that we then begin to, I often describe it to my patients as peeling an onion. There are layers to things. And so I take them back and I ask them to begin to recount. I'll never forget a young lady, very young, 27. Well, 27 is young to me, all right? And to you, I'm sure, but, because I don't want to offend any 27-year-olds, but, the amount of trauma she had been through, by the time we peeled it back, it related to her mother leaving her father when she was about 3 or 4 years old. But she hadn't quite pinpointed her issues to that until we had that session, those sessions. And then it turned out that was actually, someone may say daddy issues or mommy issues, but it was real to her. And she began to cry and weep. And even now, she's still, so the second part of your question was, how do we deal with that? She's not on medication. But what I scheduled with that particular young lady was, we had a monthly sessions, but I also took her through a lot of psychotherapy where she needed to have a change of mindset. So again, it had to do with a lot of forgiveness, forgetting the past, building a positive self-image, loving herself, because she didn't, okay, here, the way it all started from was, she was struggling with her romantic relationship. She just couldn't, she thought every boy was a menace. And she was a beautiful girl and she was struggling and she was suffering to the point where she was almost being hospitalized because of her problems. So it started with just being able to love herself and say, look, it's not your fault. That's why I put in my slides, reorientation. There has to be a reorientation. And so for people who don't want medication, they may need several sessions of therapy. They will need, in fact, several sessions of therapy. They might need a coach. So what I did for this particular young lady was I became a mentor and a coach to her. She had a religious background. And so it was easy for me to step in there because of my other hat that I wear. And we had sessions every Monday. There's a few. So I don't know if you know this, Ngozi, but I have a youth group that I mentor. And it started with single moms. I think I've mentioned this before. And it was for troublesome teenagers, because I used to get a lot of calls about, troubled kids. And then when it became too much, I started bunching them all together. We'll have a Zoom meeting. That group has grown from 3 to about 80.
Wow.
And so every 3 or 4 months, I have a session with them. I have younger guys that I have mentored that I send to deal with them. But every 3 or so months, I sit down with them. They ask their questions. They don't have to show themselves. It's all anonymous, but some of them have become friends. Some of them have grown and gone on to study good courses. One of them is planning to study medicine. These are all children that were set for expulsion. So to answer your question, for those who don't want medication, it's fine, but they're going to need a lot of therapy, and they need to be in that environment where someone's looking after them and someone's helping with that.
Thank you. Thank you, Dr. Joe, for all you're doing, because there'll be people who are coming to those sessions that this will be a lifeline for them. One of the things I want to ask you, and we talk about counselling and support, how much do you think, how important is the cultural aspects in this? You know, how important is it for someone from an Afro-Caribbean background to be mentored by somebody from their own, that has a cultural context? And the reason why I asked this was a few years ago, I knew somebody who got in trouble with our regulators. And when he went for the meeting, the first thing he said he wanted to do was to pray. And he started to pray and speak in tongues. And that didn't go down very well at all.
I would
but
imagine.
if he'd done that in Nigeria, they would have understood the context, isn't it?
Yeah.
So how much is it? How much do you think it's
This is a very
relevant? Is it important?
Ngozi, it's huge. It's not only relevant, it's massive. It is up. See, this is the back of which, this is the bane on which CAHN operates. This is why CAHN is so important. Look, anybody who knows me knows that I'm not a racist person, or but really the truth of the matter is, a lot of what we go through in the Afro-Caribbean community is poorly understood by people outside of our community. People don't understand our culture. People don't understand our spirituality. People don't understand our food. Loads of things. So it is absolutely crucial when you have someone who understands where you're coming from and is able to speak your language. Not necessarily, I've counseled Zimbabwean people, I don't speak their language verbatim.
I don't mean the language in terms of your understanding of their culture.
Understanding their cultural context. I've spoken to Egyptians, Eritreans, Somali. You should see their face light up when they see a guy who understands, Pakistani, who understands the culture that they are coming from. So it is massive. It is absolute. I think even within the NHS is now being recognized. And they're now trying to introduce, it's baby steps. They're now trying to get, racial diversity on boards and in places, because I mean, the very popular example, a young man wrote a book on it. Skin disorders, dermatologic disorders, poorly understood by our white colleagues. And so, because in the curriculum, because I teach medical students, one of my other hats that I do, in the medical curriculum, there's no black skin for them to learn from. Can you believe that?
I know. I remember as a pediatrician, one of the things we're taught about is non-accidental injuries, so injuries that have come about by somebody harming a child. And they talk about the bruising and what color. I remember thinking to myself, well, I've never seen, this orange, brown, and purple.
Exactly. You don't see it in brown skin.
And when you present, they had to have a separate section for, those the skin color that some babies have, Mongolian blue spots at the back of their
blue spots.
Yeah, lots of babies would be brought in with being told that there was an injury. I'll come to the hand up, but just before I do, somebody's got the hand up. Somebody's asked about, can palpitations lead to heart failure? And I think that's an interesting question, because all of us have had anxiety. Sometimes anxiety is positive. You're going for an interview and you're pumped. You need a bit of an adrenaline to get you going.
Yeah.
But in actual fact, that's why we say sometimes anxiety and panic attacks are debilitating, because your heart's going a bit too quick. So this is someone who's asked, can it lead to heart failure?
In the strict sense, no. Palpitations do not lead to heart failure. In very strict sense, no.
So
The kind of palpitations, in terms of the kind of palpitations you get from anxiety, because we're medics, so you have to qualify this.
Yeah.
What's causing the palpitation?
Yeah.
Now, if it is palpitation from anxiety, no way. Can it eventually lead to a heart attack? Possibly. Yeah. Now, if the palpitation is caused by defective heart valve, or because you've got a hole in your heart, that can lead to heart failure. But it won't be the palpitation itself. The palpitation is a symptom, it's a manifestation of something else that's going on. So palpitation is often a symptom of something. So it could be a symptom of anxiety, it could be a symptom of something physical going on in your heart, which is why in my talk, I brought on mitral valve prolapse or atrial valve, because if you've got a valve prolapse, if you've got something wrong with your heart, you will have a racing heart. That can lead to heart failure, but not from anxiety.
Thank you. Ellie, do you want to ask your question? Thank you for joining us. Question, comment?
Yeah, can you hear me? Yeah,
I can hear you.
Yeah, okay. So
Did I
I'm
pronounce your
Ellie.
name right? Ellie, is it?
Yeah, Ellie. Yeah. It's French name. Yeah. Actually, I've got like a 2 question in one.
Okay.
I'm asking if there are also some anxiety which are normal as part of our life, because from my experience, I'm so I don't know if it's an excitement or is an anxiety. Every time that I've got like an appointment, before that, it's like I want it to happen, and then I move on. Whenever I am in the joy, I like party, and whenever I've got I'm invited. Yes, I'm invited to a party. Before that, I am so excited to to see it happen, and then to see how it's going to go. I like to be very well presented. So before any like events, I have to like take time to think whatever I'm gonna put on. I mean, I'm in terms about clothes. So those kind of things, and also when it happened when I'm in a joy, somehow it happened also. That kind of, I don't know if it's an excitement or anxiety. So in between those, that's why it's my question. So does there any anxiety which are normal as part of our life?
Thank you. That's a really interesting question, and thank you for the question.
Ngozi, you're muted.
Thank you. We still make these mistakes many years after using video conferencing. Yeah, but thank you, Ellie. Just before you asked your question, I was describing to Joe that sometimes I find anxiety is helpful, especially if you're either about to talk to a large crowd, about to go to an interview, and maybe you're anxious when you're going to a party because I don't know what your situation is. Maybe you're going to meet somebody nice, have a good time. But I'm sure Dr. Joe can answer that. But I think some anxiety is great. It's fine because it keeps you on your toes. It keeps you aware, and that's why it's there. We've got our adrenaline response to some things, and that's helpful. I think it's nature's way of getting us ready. They say for fight or flight, and sometimes for enjoyment. Go on, Dr. Joe.
Yeah, thanks, Ngozi. You're absolutely spot on, of course. The thing is, I remember thank you, Ellie, that's a really good question. I did a session here on stress, and we talked about the fact that a little bit of stress, a little bit of anxiety is actually good for you. That is your body or nature's way of getting you prepared for a difficult situation. So some form of anxiety is actually needed and helpful. Every time I'm about to do public speaking, I get a little bit of anxiety. Look, I've been preaching in church for 20 odd years. Every single time I get anxious. And what psychologists tell us is that it is actually helpful because it helps you prepare better. It helps you to be sharper. It helps you to be more focused. So some form of anxiety is actually really, really important. Remember at the beginning of my session, I said a lot of the psychiatric symptoms or mental health symptoms are simply an extension of your normal body response. So like we talked about pheochromocytoma, where the kidneys are producing too much adrenaline, etc. In normal body responses, your body produces those things. For example, if you saw a lion and you were in the safari in Kenya, and your body did not produce adrenaline, and you simply stood there, all right, guess what? You will become lion fodder, all right? So your body's response, or you saw a snake or in your house and it looked poisonous, the body's response is to help you get out of there, do something about it, or you touch something that's hot. That withdrawal, that instinct to get away from that, even to blink, is your body's response warning you that there's danger. So we all need a little bit of anxiety. However, when it becomes prolonged and sustained and crippling, if you go back to my, and maybe you weren't at the beginning, if you go back to the early part of my slides, and I think we should make slides available for everybody. These are my slides. I didn't copy them from anybody. It's copyright to me, so I'm giving them away free. I can charge you carrot cake later on, but it's absolutely free. If you go back to my slides, I said, for you to define anxiety, it has to be prolonged beyond 6 months and to happen on 3 or 4 more days. And it has to have some sort of effect, on a crippling effect on your life. Anxiety is good. Anxiety helps the surgeon to be focused so that he doesn't make a mistake. But when you are so anxious that you cannot hold a knife to operate, that's a problem. So I hope that answers your question. So some form of anxiety, like Ngozi rightly said, is absolutely crucial and necessary. Somebody asked a question about the pediatrician, somebody mistaking their daughter's birthmark as abuse. Unfortunately, this happens all too often. Yeah. And this is why what Ngozi's question is really, really important. When you have a pediatrician who's of ethnic minority who has seen this before, then it's easier for them to understand where you're coming from and what your daughter is experiencing. But it's an ongoing situation where we have to deal with that. Like I said, somebody asked a question about cockroaches. Not liking cockroaches is not a bad thing. I'm just saying that if for it to be a phobia, it has to be a lot more severe than I just don't like cockroaches or I don't like flies, etc.
So for those objects and things that provoke a real anxiety, so it might be a bit more. So this lady has talked, or this person has talked about a real fear and aversion to cockroaches, or what it could be anything. I've heard of something called flooding therapy, where if it's really debilitating, they use a kind of therapy called flooding therapy, where they just swarm you with cockroaches. It doesn't sound very good, but have you come across that?
Yeah. It's part of there's lots. There's flooding, there's systematic desensitization. So basically there's flooding where they just, depending on the individual. So it's very tailored.
And I suppose it depends again, whether, there won't be many cockroaches in Manchester.
No, so I've seen them in East London.
Oh God.
I'm sorry, London people, but I've seen them in East London, and rats.
Oh yeah, I suppose it depends on what the situation is. So if you needed to work, if you were a zookeeper and you need to work and you need to work around these animals, then yes. But if you're not going to encounter them, then you could just leave it be, isn't it? And just hope that you don't bump into them in your day-to-day activities.
Oh, absolutely, absolutely. Make sure you keep your house clean and avoid the situation where those cockroaches or those kind of things come into place, and avoid East London while you're at it. So
apologies to our East London people here, Joe.
My people from East London, please forgive me. I'm just saying,
Yes.
I saw it. I was there. Not, I was in East London, and these roaches and rats, they came, and I was wondering what was going on. So by and large, it's these things happen to a lot of people in many shapes or forms. It's about avoiding those situations and making sure that those things are not there. But you don't see a lot of that in Manchester.
Yeah.
All right.
The other thing I think I want to just clarify in terms of therapists.
So you were asking about flooding therapy.
Yes.
Yeah. So it depends on the situation, and these are deeper. These are for very severe illnesses where there's, again, like I said at the beginning, this is on the scale. There's many people who suffer really, really bad, and they were to the point where their life is being threatened by these phobias. You have flooding, you have systematic desensitization, where I like systematic, where they simply introduce you in small aliquots of that. The opposite of that is flooding, where they make you realize that even though there's so many rats around, they're not going to harm you. But you can't just throw that on anybody. There has to be discussion, and it has to be done by trained specialists.
Okay. I think, because I guess some people have joined today because they have an interest in this topic, and others might just want to have just general updates and information, and are regular listeners. But thank you for saying that you will share the slides. And also, do you want to say a bit more about what CAHN does in terms of supporting mental health, so that people know where to approach for those resources?
Yes, with all pleasure. So I can't speak highly enough of the mental health counseling department that CAHN has. So we have a dedicated team of trained individuals who will provide you with support, who will signpost you, who will sit alongside you, stand alongside you in difficult situations. All you need to do is to get in touch with CAHN via the email or the website. I think it's been put on here. There's a link, that health@cahn.org.uk. There's a triage system that we use, and then you will be signposted to the most appropriate person. I have been involved with them very actively over the last couple of years, and it's really been very helpful to a lot of people within the community. I'll give you an example, just a couple of examples. There's a young man who unfortunately began to have hallucinations and things like that. Long story short, it turned out that he had used some adulterated cannabis, weed, and he began to develop some of these symptoms. And so I saw him initially. We cleared him from a medical standpoint, and then I introduced him to the counseling team, and he's flourishing. He's currently studying again at a university, studying engineering. He's doing really well. So the team is amazing. They're available. You will be seen to immediately. And the best part, it's absolutely free. That's right. You heard it from here. It's absolutely free. I would encourage you. I think the problem, Ngozi, that many of us have in our community is that lack of engagement, lack of trust. But these are your people. These are people that look like you. These are people that are for you. These are people who are there for you. So I want to encourage everyone, if you know somebody who will need the service, please take advantage and use it. CAHN get funding from other places to make this free to you. And sometimes we need to be able to prove that we're actually using this service. So please, I would encourage you to take advantage of it and use it. I know they're a bit busy, but I'm just saying, let's take advantage of this so that people don't suffer in silence, as many people have alluded to in the chat.
Okay, thank you. Just to say that someone's asked for practical tips and how to deal with motivation and focus when you've come out of a divorce, and how you move on. Because I guess that's a situation that can cause you quite a lot of anxiety and stress. So,
sorry, what was that question again?
Any practical tips of how you, so I suppose the broader question here is practical tips for dealing with panic and anxiety and stress. This specific one was about divorce and how, when you're coming out of a situation like that, how you move on. And please could the CAHN team just pop in the chat the details for the counselling service, because I think people would be interested in that.
I think people are asking for it. Yeah. Thank you, Ngozi. This is a really good question. It's also a very complex one, as you're probably aware. Divorce is always never simple, and it varies with different individuals who may be involved. One of the things that I would say is that, you know, there has to be closure, and there has to be, you have to move, you have to be ready to love yourself and forgive. That's just my own advice, that because a lot of times people struggle because they still hold on to grudges with either, not even divorce, like past relationships. Someone did you wrong in a business, or somebody jilted you in a relationship where you thought it was going to lead to marriage. And holding on to that past experience is often harmful to you and not necessarily to them. You know, somebody said unforgiveness is like drinking poison and expecting the other person to fall down and die, you know? So I often find that part of the ways of moving on is just like the song in Disney says, and I don't plan to, I'm not hoping to minimize, let it go. Let it go, just let it go. The first part I find useful is you have to forgive yourself, forgive the other party. The other thing that you need to begin to do is to begin to rebuild your life, refocus, and understand that it may not necessarily have been your fault, because very often when I've counseled people who have been in divorce situations, there is this sense of failure, that maybe I could have made it work. Maybe I should have tried harder. Maybe I should have done this. And sometimes there's nothing you could have done. There's nothing that you could have done any better. You know, and so you just have to accept that and sort of try and move on. You need to speak to a professional counselor. You would need to speak to a member of our team. Our team here in CAHN will be very happy to help you. If along the line they feel that my input, this is how it works actually. When you come in, you get triaged, then you speak to the counselors. Then if they feel that you need further input, it comes to me. If I then feel it needs even further input, we get a psychiatrist or psychiatry services involved, whether private or paid, but or the NHS. But basically, that's the steps in which we tend to employ with this. I think you're going to need, it's a journey. That's another thing. Don't be in a hurry to suddenly heal, because you've been through a traumatic situation. So forgive yourself, forgive the other person, move on, and begin to rebuild. It's a journey, it's not a sprint.
Thank you so much, Dr. Joe. There's a question here, and I think it relates to something you said in your talk about preparing to retire. That can cause anxiety as well. And I know this is probably another topic, and that's the one we should probably address, because we have lots of people in our community now that have been here for many years and are getting to the point where they're looking to retire. But if your work has been your whole life, a really significant part of your life, which our work is, thinking about stopping that can be difficult. It can be difficult from a sense of well-being and worth. It can be difficult from a sense of finance as well, depending on how you've prepared. But it leaves a big void in people's lives to just stop doing the thing that you've been identified as. You know, I know people say, Ngozi, she's a doctor. And then, so what happens when I'm retired? Am I just, you know what I mean? So it's such a big part of who you are that I can imagine how it can cause a bit of anxiety about thinking about what to do with that time that you have. And then again, someone's put about the isolation, the fact that you have to go to work and you meet people all the time, and that stops. So someone's asked a question about how you deal with that. And I know we don't have a lot of time, but maybe just a couple of minutes.
We don't.
Signposting maybe. And maybe this is something we can address at another talk, because I think there'll be lots of people who will be interested in something like this.
Yeah. You know, unfortunately, there isn't enough time, because this is a very important subject and it's a very loaded one. So first of all, where do I even begin? It starts with identification. So you made a very good point, and this is what I teach in one of my leadership sessions, because I do leadership and business sessions free of charge. Again, free of charge. You have to have an identity that is separate from your job. You are Ngozi. What you do is a doctor. You are not a doctor because you are Ngozi. Does that make sense? So you are Ngozi. You are a mother. You're a wife. You're an excellent person. You are our next prime minister, if I have my way. But being a doctor is just one thing. What a lot of us do is that our job takes over our whole life. And when we then retire, that is why a lot of people don't last when they retire. Because they're bereft of ideas. What do I do? And like I alluded to in the lady who suffered with anxiety during my talk, that was exactly what happened. She retired as a midwife, and then she suddenly didn't know what to do. So retirement planning for me starts with when you start working, and you need to, there's many aspects of it. There's a psychological aspect where you need to start identifying the fact that I am Osage Joseph Omofuma. What I do is a doctor. That's not necessarily who I am. That's what I do. So who I am is this, and there's many parts to that. The second part of it is you have to plan financially, you have to plan emotionally, you have to plan psychologically. And so having worked in a place for 49 years, like someone put in the chat, first of all, get your house in order, speak to a financial advisor. A lot of my friends were surprised when I began to write a will at the age of 35. This is a few years ago. I wrote my will at the age of 35. Why? I lost a relative very early, and he didn't have a will. And he was very well to do. And the government took almost all his money. But again, like you said, this is you opened a whole new conversation here. Somebody put in the chat, letting go within our communities, forgiveness from trauma, one huge topic. Planning for retirement, another huge topic. Perhaps the admin team can take note of these, and we can plan to do them. Like I said at the very beginning, I knew that we wouldn't have time to cover everything, and I hope we can plan those sessions going forward.
Thank you, Dr. Joe. Thank you so much. I think a session looking at age and retirement, because we've had topics on geriatrics not very often, but something about the psychosocial aspects of that, I think would be really helpful. Yeah. I want to say on the behalf of the CAHN team, a really big thank you to Dr. Joe. I think you bring to these sessions your medical experience, but also the experience you bring as a pastor is invaluable as well. So thank you so much for hosting this session. And I personally, I've learned a lot today. I'd like to hand over to Larinti, but before I go, please look in the chat and give us some feedback and suggest topics that you'd like us to host on these health hours as well. Once again, these are for you, so just bear that in mind, and thank you so much. I'll hand over to Larinti from the CAHN team, and thank you.
That's great. Oh, thank you. And thank you, Dr. Joe, for a very informative session on panic attacks and generalized anxiety disorder. I've learned a lot today. It's very enlightening and very informative with great discussions. Thank you. And also thank you to our fantastic host, Dr. Ngozi, again. Thank you very much. And thank you to all our attendees on Zoom, Facebook and YouTube. And if you would like access to today's Health Hour sessions, Dr. Joe's presentation, as he mentioned, and please do email health@cahn.org.uk, and also remember that you can access our sessions on the YouTube channel and also our previous sessions as well. And also please do complete the evaluation link, which is in the chat box. Thank you, Nicole, as we'd love to receive your feedback and ideas as well, which will be great. And I will now just share some of our upcoming events with you. So please do put them in the diary and share them with your family and friends. So I'll just get the information up for you now. I'll just screen share. There we are. The presentation slide. There we go. Right, okay. Fantastic. So our next CATHIP Health Hour session will take place next Saturday, which is the 4th of February, same time, 11 till 12:15. And to register, you can email events@cahn.org.uk. And please do keep an eye out on social media for the title of the topic for our next Health Hour. Also, taking care of your health starts from controlling your diet, and please do join us on our Healthy Heart session, which will be next Tuesday, 1st of January, where you can learn how to improve your diet and well-being, as well as having the chance to exercise with our physical instructor at the session. And to register, you can email events@cahn.org.uk. And again, please keep an eye out on social media for the topic for our Healthy Heart session next Tuesday. Please join us to help those experiencing domestic violence and families who are struggling by donating to our crowdfunding campaign. So far, we've raised £1,500. So please do donate. And the address is www.crowdfunding.co.uk. Please do donate or contact us at CAHN. So CAHN invites you to a health and wellbeing fair. Do join us to network with others across Greater Manchester, apply for job vacancies at the recruitment stalls, or ask questions directly to clinicians and more. And that's happening today, this very minute, 11 till 6 p.m. And that's at the Victoria Outreach in Manchester. And that's Liverpool Street in Salford, M54LY. And International Women's Day is approaching, so save the date, the 8th of March this year, and keep an eye on social media for more details on the International Women's Day event. Or you can also follow us on Twitter, Instagram, and Facebook. And do not forget that during tough times, you're not alone. Do contact our advocacy and counselling service, as mentioned in today's session, and they're available every day from 9 a.m. till 9 p.m. So if you need any support, please don't hesitate to call, which is 07710 022 382, or to email help@cahn.org.uk. And I would just like to say a big thank you to our CATHIP partners as well. Do contact the service in your area for further information if required. So first of all, thank you to CAHN, Caribbean African Health Network, then to RAFA International Development Agency, also Black Health Initiative, Croydon BME Forum, Enfield Caribbean Association, the Royal Assembly Redeemed Christian Church of God, and thank you very much. So I will return back control to you. Back over to the comms team, please.